There's this pidgin adage where people say, wanna no get, getter no want. You see, when you are in medical school and you are drenching, you are thriving, you are striving to, complete the school, you want to be done with this school stress, and the school is stressing me, and the blah 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 blah. Yes, the school is stressing you, but are you really prepared for the world outside there? Are you really prepared for the stress that comes with your career? Hi guys, my name is Dr. Olonga Gomez and welcome back to my YouTube channel. On this channel, we do everything medicine, everything lifestyle, everything beauty. So in today's video, we are going to talk about the common sense of house job. If you know you're a house officer, a final year medical student, an intern, a junior intern, whatever it is called in your country, then this video is for you. If you are yet to start Housejob, this video is for you. In case you didn't know, I have started Housejob. I started about 2 months ago, and when I was about to start Housejob, a good Samaritan shared something with me that I think that my colleagues out there will benefit so much from it, and even some seniors out there will benefit so much from it. Which is why, me being so good of a girl, I decided to come and share this with you. It is what they call Marik's common sense of house job. I did not unwrite this intelligent piece. It's something that someone shared with me, and I thought I should share with you guys. And in one way or the other, it's going to go a long way to help you in your career, just as I am adapting some of these rules. Yeah. So now that you are looking up and you've not subscribed to my channel, what are you trying to tell me? Pico, what are you trying to tell me? No. You need to subscribe. I'm waiting for you. Oh, subscribe. Good. I know you have subscribed already. When you're starting house job, I know it's not easy. It gets to a time where you doubt yourself, you are scared of your first emergency posting, praying so much that you don't meet difficult situations that you cannot handle. The first on the Marik's common sense rule is that when in doubt, don't. There's something in medicine where we say do no harm. So you know that whatever you are going to do, Charlie, you are going to harm this person, or you don't know whether what you are going to do is the right thing, or whether what you're going to do is really going to work or not. It is saying that when you are in doubt, just don't. Just don't do anything. Don't talk, don't touch, don't do anything. It's when you are in doubt, just don't. The next is that common disease occurs commonly. So one advice I'll give to myself and my fellow house officers who are just starting house job or who are yet to start house job is that get to know your common diseases. Get used to your common disease. I know sometimes you're thinking, especially if you're in the teaching hospital, you'll be worrying yourself about things you're not supposed to be worrying yourself about. Common diseases occur commonly. Get acquainted with the common diseases, understand the common diseases, know how to manage common diseases. In your life in this 2-year house job is going to be very easy. Again, when you are doing any procedure, remember that nature always sides with a hidden flaw. The tiniest flaw that you hide, it is going to catch up with you. So when you're doing any procedure and you make a mistake, this is the time you are allowed to make mistakes. Your bosses are there for you. This is the time you're allowed to make the mistakes. But mind you, dare you not hide your flaws. It's going to catch up with you and you will not like the experience in the future. Always have in mind that just when you thought things couldn't get any worse, they will. So do not think that, oh, this is my 19th day is going calm, or just when you thought things couldn't get any worse, they will. So always psych yourself up. Prepare your minds for the unexpected. Prepare your minds for things that can happen. And when you're prepared and you get met with anything that's beyond you, you know where to seek help from. You do not panic. Just relax and handle it easily. Never open a can of worms unless you plan going fishing. If you do not know what you are looking for, don't go and open up anything. Don't go and touch anything. You do not know what you are going for. That's not where you are not going to explore. You're not going to explore. You're not going to do this. You are doing this examination. What are you looking for? You don't know. You are just doing the examination. Now it will not help you and I. Remember, nothing in medicine always stays the same. There's always that gray area in medicine. So do not tune your mind to it as either this or that. You are way past that. Before you do any test or any investigation, you must decide what you are going to use the outcome for. If it's negative, what am I going to do? If it's positive, what do I need from that? If you realize that the answer to both of your outcomes are the same, then please don't do that investigation. Don't waste any patient's money. Simply put, if any test is unlikely to change your management, then don't order for it. Have in mind that there is no manifestation that cannot be caused by a given drug. So always try to understand why something is happening. Don't just ignore it and say that you gave this, which is why you don't think that it is this. There is no manifestation that cannot be caused by a given drug. Have in mind the side effects of the drugs you give, and your life will become easy. Another question for you and I is that if a drug is not working, what do? You stop it. If you are not sure what this drug you are giving is going to do, what do? You don't give it. Once again, if you are new here, welcome back to my channel. Don't forget to like, comment, and share this video. Subscribe to my channel. I know that now we are in a digital healthcare system and all of that. So if you think that whatever you are writing cannot be read, then don't write it. We are past the age where they say doctors have this particular handwriting and doctors have this weird handwriting. No, make sure that whatever you are writing, your patients can read, the nurse can read, the pharmacist can read, anybody at all can read from whatever you are writing. Any order that can be misunderstood will be misunderstood. So if you are giving any instructions or any order, make sure you are clear enough, no ambiguities. Make sure that whatever you are giving orders on, it is just what you want it done. You don't say it in ambiguous ways, thinking the person you are telling should get it done for you. Remember, we cannot read your mind. If there's one thing that I have realized so far is that never ignore a nurse's observation. Never ignore a nurse's observation. Nurses contribute so much to the care of a patient such that what a nurse will see, you might not be able to see that. I mean, what an experienced nurse attending to your clients will see, you might not be able to see that. So never ignore a nurse's observation. If you are called to see a case, just go and see it. Even if you think it's the most trivial of trivial things, just attend to it and then sort it out. You might never know what will happen afterwards. A word to a wise is enough. There's this thing that I used to hear outside. I had never experienced it, but now being in the working field, I think that it is so true. They say, be kind to nurses and they will be kind to you. Be unkind to them and they will make your life miserable. And it is true. Like, there's no two ways about it. There's no even any way to say it nicely or sugarcoat it. Like, when you are nice to them or you are kind to them, you treat them with the needed respect they earned from you. See, trust me, your work is going to be so easy. They would love to help you. But when you are unkind to them, you do not respect them, your life is going to be miserable and you would not want that. So please, let's do the needful with our colleague healthcare attendants. Last but not least, they say that no organ fails in isolation. No organ fails in isolation. Finally, remember that empty vessels or empty barrels makes the most noise. Housejob is a period of learning, it's a period of studying, it's a period of apprenticeship. That is not the time you are going to boast, and I was the best in this in my school and I was the best in that one. They are all a plus, okay? They are all a plus. Shout out to all of you who got the best in this, best in that. They are all a plus and they are very good for your CV and other portfolios. But Housejob is not the time to boast. Housejob is definitely not the time to boast. You take your time, you humble yourself, you learn, let your works do the talking for you. If there's nothing I've learned from my bosses, at least I know that in this medical career, your works will definitely do the talking. So let your works do the talking for you. I hope you've enjoyed today's video. If you did, don't forget to like, share, and subscribe to my YouTube channel. Tell a friend to tell a friend to tell another friend to tell another friend that Belinda has posted a new video. So until we meet again next time, it's a goodbye. Bye.